we've come through a very difficult period for all of our member states, and indeed internationally it's been a very difficult period. And already in July, the Commission published a communication with some ideas for a second wave, because we foresaw the danger of a second wave affecting European Union countries basically from now towards the end of the year. And also trying to obtain sufficient supplies of upcoming vaccines. So the Commission has been very active over the last few weeks in negotiating and having advanced discussions with vaccine producers. And we have in fact concluded a number of discussions with vaccine producers to supply the European population as soon as these vaccines become approved. And finally, I would mention the question of treatments, because we have a couple of treatments which are available. And we have already supplied some of these treatments to the member states using the EU budget. And we're also making provisions for purchase of additional treatments for the autumn. We're also finalizing, as we speak, a major tender to purchase, to allow member states to purchase ICU medicines, which they were not able to purchase individually. One of our big challenges in the coming months and years will be to absorb the effects of the coronavirus outbreak on our economies. And one of the key messages I wanted to give is that we may have difficulties in managing our health budgets and our health systems with this difficult economic situation. And there, I think it's really important that everybody pulls together to make sure that we have efficient, effective, patient-centered care, and that the investments are made in the right places so that our health systems can survive this difficult time. One of the big issues which we have is not only the maintenance and improvement of our health systems, but the reduction of these terrible inequalities in health. The differences in life expectancy, the chances of getting a disease in one place hugely different from getting a disease in somewhere else, and the quality of treatment being so different. So all of these issues are really central, I think, to the agenda of public health in the coming years.
Thank you very much for this insight. What is the good aspect of the pandemic? Did we have the opportunity to put in place something that probably could be important also in the future when we will be out of this pandemic?
I was in Rome for a meeting with the minister in Rome at the very, very beginning of the outbreak, when the cases started to explode in Lombardy. And I think what has been learned since that day, that meeting, is the importance of working together. The idea of sorting this problem out on a national level is very difficult. And therefore, we are, I think, coming to the recognition that each country is dependent on the other. And if there is a country which is badly prepared, and if there's a country which has poor resources in health, this undermines everything else.
Mr. Ryan, one thing that was clear from the beginning of COVID-19 pandemic is that some of our patients with endocrine diseases like diabetes, obesity, lack of vitamin D, were more at risk of developing COVID-19 and serious COVID-19 consequences. Did Brussels learn a lesson about this, in the sense that disciplines that work in the prevention area to build a healthier population are not minor, in brackets, are not negligible in their action, but can be very important to be prepared for something that really can affect our population?
So I would say there's a huge issue around non-communicable diseases, because one of the characteristics of Europe is that we're getting older. We are investing very heavily with the member states in trying to find effective ways of prevention. And the Commission launched at the end of last year, at the beginning of this year, an initiative on farm to fork, which has a very strong component on better nutrition for the population. So we're not talking about individual patient advice here. We're talking about how can we improve population health through better quality food and availability of better quality food, and making people, giving people the opportunity to feed themselves better, to have a better nutritional profile.
The EU for Health program for research, can you say a couple of words on it? And is there a place also for topics that are related to endocrinology, to metabolism, and to these topics of non-communicable diseases?
Yes, so I'd like to distinguish for your listeners we have two funding instruments in health, which I think are of interest to you. And I'll describe both. The first is the Europe for Health program, which is being finalized at the moment between the ministers and the Parliament, which will allow interventions in a number of public health areas. For example, in the prevention of disease, whether communicable or non-communicable, in encouraging better treatment and better care for patients. We have a network of European reference networks, as we call them, which bring together experts like yourself, other hospitals around Europe, around a specific disease, particularly rare diseases, but also other diseases. So this is something we encourage through using the health program. We also intervene, for example, in setting up networks with the member states. Good example would be a diabetic screening network or a cancer screening network, where the member states who are interested can come together using a common model.
Thank you very much, John. I think in this respect, a curiosity. We often have the feeling that endocrinology is not perceived as very clearly by the lay public as a discipline, as something that is clear in the role. What is your perception personally about endocrinology when we speak about this discipline, and your perception of what the Brussels environment?
Well, I think it's not so clear to the institutions, perhaps to a minority of my colleagues on the public health side and maybe also on the research side. It would not have the same profile as some of the other issues we deal with. And I think perhaps one of the solutions is to involve, with your work as a professional organization, to involve the patient voice. Because if there's one voice that carries very clearly, it's to have a patient experience. And I know that you also have a close relationship with your patients. And I would just say that if you want the voice of endocrinology to be more heard, either in the European Parliament or in the Commission, it's always a good idea to try and have this alliance of the health professionals and the patients.
Thank you very much, John. Just one last closing consideration about your practical view on relationship between a society like us, the Brussels institutions, and eventually our foundation in this scenario.
So what I would say to you is that we welcome dialogue with professional organizations. We also welcome organizations to give feedback on our policy papers. So there are many of these topics where I think the societies could make a contribution from your point of view and your perspective, and using your expertise to enrich the policy at European Union level.
Thank you very much, John. I think that this discussion has been of paramount interest for all the attendants to the meeting. Thank you very much, John, for being with us.
Thank you.